Good morning and welcome to our webinar on student assistance and response to intervention. Our presenter today is Don Mitkus, who currently works at Alexion and is a former SAP coordinator at a suburban high school in suburban Chicago. I want to welcome everybody to our webinar, and I hope it is beneficial. You'll see on your screen a list of our upcoming webinars. In 2 weeks, we'll have a guest from Rockford doing a webinar on educational support groups for students with an incarcerated parent. And then on April 1st, we're going to have some of our own Student Assistance Center staff and a VISTA volunteer from up in Chicago doing a webinar on using check-in, check-out as a student assistance intervention. And you see the rest of those there on your screen. We look forward to having you in attendance at any and all of the rest of those the rest of this year. Without further ado, I am going to turn things over to Don for his presentation. Don, here comes control to you.
All right. Okay. Thanks, Dale. Let's see if we can't get this. Thanks, Dale. Again, my name is Don Mitkus, and if you bear with me for just a moment, I'm going to see if I can get you guys to see my slides there. Dale, can you tell me if the slides are showing?
I do not see them currently.
Okay.
Oh, hang on a second. There you go.
Very good. There it is. Okay. Okay, excellent. Thanks again, Dale.
Mm-hmm.
And again, my name is Don Mitkus. I'm a licensed clinical professional counselor, currently working as a consultant with the Student Assistance Center Prevention First, and my primary role is working with Alexion Brothers Behavioral Health Hospital. As Dale mentioned, I am formerly a Student Assistance Program Director. Prior to being at Alexion Brothers, I spent a few years as the SAP Director in a large school in the northwest suburbs of Chicago. And part of that role was, when I was there, response to intervention was rolling out, so to speak. And that's what we're here to talk about today, is student assistance and response to intervention and how they fit together, so to speak. So today what we're going to be covering is we're going to do a little bit of a primer on response to intervention and why it exists. Why are we being subjected to RTI? We'll talk about the components of student assistance programs and how they somewhat nicely mirror what RTI is trying to accomplish. And we'll talk about the differences. So if these two models, so to speak, are complementary, why have both? Well, what we'll talk about is what SAP does that RTI does not, and how RTI can be of assistance in helping build sustainability for your student assistance program. So let's jump in. So what is RTI? So here's the definition from the National Center on Response to Intervention. RTI integrates assessment and intervention within a multi-level prevention system to maximize student achievement and to reduce behavioral problems. With RTI, schools use data to identify students at risk for poor learning outcomes, monitor their progress, provide interventions that are evidence-based, and adjust the intensity and nature of those interventions depending on how a student responds, and identify students with learning disabilities or other disabilities. So that is a pretty dense definition. There's a lot there, a lot to pick apart. But one of the things, just to start out, that I want to point out in the definition is the last part: identify students with learning disabilities or other disabilities. RTI is a mainstream non-special ed model. It is not meant to be special ed. It is meant to live in that space of the whole school, and before you get to special ed. So this is a regular ed initiative, But in a lot of ways, this regular ed initiative is similar to how special ed services are determined and developed and how IEPs are structured. And at its core, RTI is meant to prevent more kids having to go into special ed or receive special ed services and to intervene with them earlier. So what's the point? Why response to intervention? It's an outgrowth of No Child Left Behind. The goal of RTI is to close achievement gaps, reduce, as I just mentioned, to reduce the number of students being identified for special education. If you have an average school population of special ed people receiving special ed services, it should be somewhere in the area of 5 to 7%. Some schools are much higher than that. The school I worked at was 15% of our student population had an IEP, which is an astonishing number. So RTI, by having an RTI framework in your school, the goal is to hopefully intervene with kids before they're sent through a process for being identified for special ed and being set for a case study. So RTI also emphasizes high-quality, scientifically based instruction and interventions. If something doesn't have some good research behind it, RTI does not support its use in a school setting. One thing to take into consideration, RTI is really a three-sided approach. It's meant to address issues in the reading domain, in the mathematics domain, and in the behavioral domain. So the purpose of our discussion here today, we're going to be focusing primarily on how it's going to affect how things are structured in the behavioral domain in the school setting. RTI is also meant to hold schools accountable for the progress of all students in meeting grade level standards. Again, with No Child Left Behind, you've got to be making adequate yearly progress and in your standardized testing, and RTI interventions are meant to help students be successful in that testing, and so the school can make adequate yearly progress as it's outlined in NCLB. So what are the four essential components of RTI? What are the four things that make it up? So it's the first one, biggest part of it is it's a school-wide, multi-level instructional and behavioral system for preventing school failure. So there's multiple steps multiple levels of intensity of intervention that can be done to help individual students or groups of students succeed where they might otherwise fall through the cracks or fail. First and foremost is screening. How are you going to identify those kids that are in need? So there has to be a screening process at all levels to identify if someone is struggling and hopefully identifying someone if they're struggling early on in that process and not letting them struggle for months or semesters or even years before some form of intervention takes place. Another component is progress monitoring. You develop a plan, you come up with an intervention, you implement the intervention, and now you have to show how they are responding to the intervention. Hence the name, response to intervention, RTI. You have to be able to show that they're making progress because the intervention has been put in place. And if that monitoring shows that they're not responding to the intervention, then we're moving on to step component 4, which is data-based decision making for instruction, movement within the multi-level system, and disability identification in accordance with state law. So if the progress monitoring shows that they're not making progress, that means that a more intensive or individualized intervention is required. So also that screening and progress monitoring will help inform the team the school, whoever that team may be working with that student, whether it's a math team or a reading team or a behavior, or in our case, an SAP team, if it's showing what that screening is picking out, hopefully, what the salient issues are, and that'll help you decide what intervention to put in place as far as how you're going to alter instruction, or what supports you're going to recommend or refer them to hopefully redress the deficiency that's been identified. And if they're not making progress, is again move them up to a more intensive intervention.
Hey, Don, I think you make a very good point here in the fourth piece of that, and that is that it's about instruction and how, as teachers and staff, we do instruction, and less about kind of and how the student responds to that instruction. Not necessarily about is there a specific kind of need behind what's getting in the kid's way. It's more about how do we do instruction, and how do they respond to that.
Right, and we're gonna, when we talk about the differences between SAP and RTI, I think there's a very crucial element that's missing in RTI that we'll talk about, where SAP fills that gap, and it speaks directly to the point you're making, Gail. So RTI is all about getting test scores up, so kids can make adequate, the students and therefore schools can make adequate yearly progress, despite the fact that adequate yearly progress in reality is becomes self-defeating as the percentages to be able to make AYP grow higher and higher. When we're talking about RTI and SAP and where they kind of match up, there's in the behavior domain, here's a model about a multi-level prevention system. Prevention meaning prevention of failure. So the primary prevention level, and again, we're talking about, this is the, when you're talking about a multi-level prevention system, the first level, the first part of it is this is how you're addressing the entire student body. So the primary prevention includes high quality core instruction. So having a good curriculum that is evidence-based, having a good behavior policy that is evidence-based, having structure in your school, having a good attendance policy. These are all things that are good primary prevention. Secondary level includes evidence-based interventions of moderate intensity. I mean, it seems obvious, but this is where, if someone is not responding to that first level, and we'll talk more about this in tiers, that you have something you can move them up to in smaller groups rather than addressing the whole school with these interventions. It's meant for smaller groups. And then for those that are not responding to those, you have a tertiary prevention level, which is more individualized. At all levels, however, attention really needs to be focused on fidelity of an implementation. The thing about evidence-based programs, evidence-based curricula, is the evidence is based on how that curricula, how that program is implemented. That's what they study. They study how it's implemented in a school setting with a particular population. Hopefully they're comparing it to a student body or population that is not receiving that intervention and comparing it. And if the program or curriculum is effective, there'll be a statistically significant difference in performance for those students. In order for a school to benefit from that program, that curriculum that's evidence-based, is you've got to do it the way it was done in the research. You have to implement it with fidelity. When you start altering things or changing things, you alter the effectiveness of that particular curricula or program. Of course, you do need to make considerations if there are cultural or language differences in your student body. And hopefully there's been, if the research is robust enough, there will be considerations for that in the discussion of the research of how that can be implemented with those, with cultural sensitivity and accommodating for language differences. So screening, again, we talked a little bit about screening already, but screening happens in all three levels as well. So you're when you're determining what sort of interventions you're going to place in your curriculum or in your behavior policy, you have to have something to inform what those are. So you have to screen your entire student population, and this is usually done like map testing is a good example of the universal screener for math and reading. Typically, all students are coming in for a lot of school districts. You're using map testing to do placement. What level reading, what level math are they being placed in? Is based on a map test, and map tests have some very good research behind their effectiveness at identifying at what level a student is at in the areas of math and reading, and a couple other areas, but primarily those two. So an example of screening at the universal level when talking about student assistance, if your student assistance program helps sponsor or conduct an SOS program, or Save Our Students, which is a suicide prevention program. Part of that program is to do a response card that's that if you have concern about another student's, fill out this card, fill out a name if you have concern for yourself about feeling depressed or not feeling having thoughts even vague of suicidality. You can get someone a counselor can see those students, but that program, that exposure to suicide prevention is a good way to universally screen. Another is the Illinois Youth Survey. It's a good screener that helps pick out what areas of concern in the behavioral health domain exist in a particular school. So it helps point out amount and frequency of use of different drugs. You can tailor it if you have specific concerns about things like depression or anxiety or school refusal or self-injury or eating disorders. You can add some questions of your own to screen your student body to see if there's cause to implement some program or some services around those areas. And again, in screening, attention should focus on fidelity of implementation and using evidence-based tools like the Illinois Youth Survey to conduct that screening.
Just to add to that, on the Illinois Youth Survey, if our listeners are not familiar with the Illinois Youth Survey, it's a survey conducted every 2 years. It's free to school districts to do that youth survey, and it's then you get your own school-specific report back, and the rest of it is aggregated across the state to look at how we can compare at county and state level to our school in terms of the issues that are tested in that survey. Also, as Don was saying, you can add, I think it's up to 5 questions for free of your own to that survey as well. A very useful tool in terms of identifying what are some of the things that are going on in your student population that your student assistance program might want to address.
Right, yeah, exactly, and that's when we work with kids that are at risk, you hear a lot of things, and subjectively you're like, wow, I'm hearing a lot about self-injury. But when you want to implement something, you really need some data to back up that something is really a concern, and this is a good way to determine that, to get some data to support that some form of intervention or primary prevention strategy needs to be put in place. Progress monitoring. This is the third component of RTI. Is once you've got something in place, once you've identified a need and implemented an intervention or a program, again looking at something at the whole school or primary prevention or universal level is another way to look at it. Is how is it impacting your student body? Again, the Illinois Youth Survey is a way to engage in some progress monitoring. If you're, for instance, doing a social norms campaign around tobacco and alcohol, and social norms campaigns are typically years long in the making and implementation and looking for impact. But the Illinois Youth Survey can help inform whether or not that campaign is doing what it's supposed to do, which is reduce the amount of students choosing to use tobacco or alcohol amongst the fence riders, as we call them, that group of kids in the middle of the bell curve. That might go either way on whether or not they're going to use tobacco or alcohol, depending on the circumstance, depending on what their beliefs are about how it's going to impact them. There's that 15% at the one end of the bell curve that's going to engage in alcohol or tobacco use, regardless of what information they have presented to them. And there's the 15% at the other end that's absolutely not going to mess with that stuff because of their belief systems, no matter what information you give them. But there's that group in the middle that could go either way based on their information at hand when faced with that choice, and that's where social norms that's the group that social norms hopes to impact. Is to let kids know that that not all of their peers are drinking, and not all of their peers are smoking cigarettes, and hopefully that will help them make a good decision. So, Illinois Youth Survey, for instance, can inform whether or not that sort of campaign is showing results, and over a long-term trend over the course of years. So. That's a little bit more longitudinal than you might do in a typical progress monitoring for RTI, but that's one example. Another example is if your SAP team is intervening with somebody and they've gone to treatment and now they're back in the building and they're going to their outpatient therapy sessions, doing those check-ins with the students, doing those check-ins with their teachers as far as their attendance and attitude towards school and all that stuff that you measure when you're getting your information together to do your intervention. That sort of progress monitoring can be helpful in showing whether or not that intervention continues to be successful, or whether or not the team needs to get back together to have a discussion with that student and the family. And then database decision making. So. Again, you're collecting information through progress monitoring, you're collecting information from your screening, and that data that you're collecting will inform whether or not you continue to intervene, whether or not the intensity of the intervention changes, because here's one of the, if RTA is being implemented with some form of fidelity, you're not just moving kids up in intensity of levels. The RTI is also meant to inform when a student should be moved down in intensity of level of intervention, that they've responded, they're doing well, now let's back off and let them continue along this course. And we'll keep an eye on them for a while, but let's, unfortunately when you have a student, for instance, that's, you got a case study that's done and they're placed in special ed, it's not often, it's far more often that someone moves into special ed than someone moves out of special ed. And usually moving out of special ed is because there's a parental request in a lot of cases, in my experience at least. So it's the good thing about RTI is that you're making decisions based on the data. Are they responding to the intervention? Have they responded to it? Do we need to continue the intervention, or can we step them back down to, from from the moderate level to the tertiary level, can we back off this intervention? And the data will help inform that decision. And data is always in a well-structured RTI model and a well-structured SAP model. In both cases, data should be driving the decisions about whether or not whether or not you're doing more, doing less, or staying the course. So we alluded to this, but there's RTI has a three-tier approach to intervention. This pyramid may look somewhat familiar because it's utilized by other programs. PBIS is one of them, if you're familiar with PBIS, where you have 3 tiers of intervention, and it's in a pyramid shape because the amount of students in each tier grows smaller as you grow in intervention. So tier 1, students are learning or behaving in a way that is roughly grade level or above, and are least likely to fall behind or least likely to need some form of intervention. Tier 2, and this is in regards to instruction. Students are lagging well behind their peers, their weak progress on screening measures, and may require some remediation or intervention in order to catch them up. And tier 3 is students that are really struggling, that they're over a year behind their peers, very weak progress, and require some form of intensive intervention. In general, tier 1 is going to be about 80. It's also known as the universe level. It's about 80% of all students are going to fall in this tier. About 80% of students are going to get through, should be getting through school without needing much in the way of more intensive intervention. Typically, your school curriculum and your school behavior policy is going to be enough to get students through their 4 years, their 8 years of elementary and 4 years of high school. And also, so that's in regards to behavior as well. So tier 2, again, it seems obvious, but it's for those that do not respond to the universal tier 1 interventions. These tier 2 interventions, they usually occur in they're small group interventions. So they can receive, that student can receive, along with other students that are struggling, more targeted or differentiated instruction. So in terms of, say, a student that's falling behind in math, this might be a math lab or a reading lab that a student that's falling behind can receive more specific instruction or differentiated instruction to help them catch up to their peers. And it might be a short-term intervention, it might be a few weeks, it might be a month, it could be a semester. You see this, we saw this a lot with transfer students coming from other schools or other districts moving to the school I had worked at was a very high academically achieving school, and students coming from other districts that weren't from our direct feeder middle schools typically needed some form of intervention to catch up. So this would be a tier 2. In regards to SAP, this might be a support group. This might be a COA group. It might be an anxiety group. It might be a post-hospitalization group. It might be something where the student needs some additional social emotional support in order to do their best in the academic setting. And that's where an SAP team or social worker or counselor might come in once a student's identified as having some issues in the school domain, and the determination is it might be something social emotional. This sort of group might be helpful in remediating their issues and giving them some support so they can do better in school. So tier 3 is for students that need, and tier 2 is supposed to be somewhere in the area of 15% of your students. At some point, 15% of the students are going to need some more targeted instruction or targeted intervention because of issues that they're having. Tier 3 is really meant to be only about 5% of your population. Tier 3 is typically your last stop before a case study. Now, some districts do identify Tier 3 as special education, that rather than this individualized instruction, if someone is in need of a Tier 3 intervention, they're moving in the direction of a case study and moving that student towards special education services and developing an IEP. A lot of school districts do not, and rightfully so. It's, there are some students that do with some individual intervention, individualized tutoring, someone who might be referred in regards to what the SAP team might do, a student that might be referred to treatment or counseling or therapy outside the school setting. That intervention might be enough to help them remediate their issues academically and get back on track without having to make the move to full-blown case study and moving them into special ed and all that. This is a student that just might need some additional individual support in order to make some changes and get moving in a better direction. So in terms of purposes of student assistance teams, Tier 3 is when you're doing an intervention and you're calling a student in individually and you're referring them for some form of assistance outside the school setting. That's a Tier 3 intervention because you're sending them out essentially because the support they need is beyond the means of what's available in the school setting. So if more than check-ins with a social worker or more than a support group is needed for them to make some positive changes, then that would be considered a Tier 3 intervention. So, close to 20 years ago, some research was done, and core components of what need to be in place for an effective student assistance program were identified, and these are the 9 that were developed and have been promoted as being essential in having an effective student assistance program, student assistance team. The first is school board policy. There's a reason that's first. If you don't have support of your building administration and district administration, it's going to be difficult to recruit people to work on your team because you won't have things like release time or getting sub-coverage or things of that nature, so people can participate in the team activities and interventions that are necessary to do the work of the team. So you need a school board policy that supports the inclusion of student assistance in your school building and school district. Staff development. I imagine over the past 5-6 years there's been a lot of staff training and staff development around the areas that are crucial to your RTI plan as it's being implemented, and hopefully it's being implemented. The thing about RTI is an unfunded mandate, unfunded federal mandate. So it's something that has to happen. But the thing is there's no teeth behind it. Not having an RTI plan at this point, and this may very well change, doesn't impact a school. I imagine, and Dale, you may have more insight on this, at some point they're going to tie it to some type of funding. But at this point, the school doesn't have to have an RTI plan implemented. If that's still correct, is that still correct, Dale?
I have not heard anything about funding being tied to it as of yet. I do know that all schools had to have an RTI plan at least on paper in place and submitted as part of their school improvement and district improvement plans. But I have not heard anything about funding as of yet tied to that.
Okay, there's a reason why schools are at different levels as far as implementation, is because of there's no even though it's supposed to have happened, there's no reason, there's no downside to not having it implemented yet. But ultimately it comes back to, for a program to be effective, the staff have to know what it's about, and your staff at your school are your eyes and ears of the student assistance team. They're the ones who are going to be identifying students that are struggling in the classroom. They're the ones who are going to be providing you with data on their progress as interventions are being implemented or put in place or enacted. And staff have to be aware of what to look for, what is a problem, because unfortunately in none of their training do they receive any education about how to identify when a student is in emotional distress or in need of social support. So again, along with staff development goes program awareness. So it's not staff development, meaning training, program awareness, not just amongst the staff, but also amongst the students. An effective program that is viewed as trustworthy by the student body can yield a number of referrals from the students or parents themselves. So having some branding of your program is crucial to better success of it. An internal referral process. How does, once someone has been identified as having having a need, a social emotional need, or struggling, having a process for someone to make a referral to the team to investigate. The easier, the better. We utilized an email form that was checkboxes. They fill out they could pull it up on the internal school website, click some boxes as for a little bit of free text space, and click submit, and it went directly to my inbox. No muss, no fuss. It's all done very, very quickly without a lot of hoops to jump through. And that's your internal referral process really needs to be as painless as possible if you want your staff to utilize it. You got to have a problem-solving team. Once someone that referral that's being made has to go somewhere, and that would go to your whatever some schools call it a student assistance team, some pupil personnel team, student crisis team. There's however your school brands it. There has to be a problem-solving team in place that's multidisciplinary, ideally. Ideally, you don't want it just going to one person and one person fielding everything. It really is to your and to the student's benefit to have a team that has representation from the different stakeholders in the school. Ideally, you want a teacher on the team. You want a counselor. You want a social worker. You want one of your school nurses. You want a dean. You want an administrator. If you can at all get an administrator on your team, it really is in your best interest from the standpoint that there are some tough decisions that sometimes are made in problem-solving teams and intervening, and it's better if you have an administrator that knows the process and what you're trying to accomplish and do to get them to buy into some tough situations where often you might be getting a nasty letter or an unfriendly call from a parent once you intervene, and you want your administrator to back you up. Educational student support groups. So once you identify that, then these core components, as I said, were developed well over 20 years ago. So if some of this is starting to sound familiar as far as what we covered before, there's a good reason for it. Essentially, SAP has been doing RTI for well over 20 years. We have Tier 2 interventions in place as part of our core components. Educational student support groups is a good Tier 2 intervention. So it could be a recovery group, as we talked about before, anger management group. These are things that are meant to provide support for students around particular issues, provide them with some education and information on how to address those issues and how to keep them from having minimal impact on their academic lives. Cooperation and collaboration with community agencies and resources. having good relationships with those that need a Tier 3 intervention, that individualized intervention where the assistance that student needs goes beyond what the school or any of the school systems can provide. You have to have existing relationships with agencies that you can refer that student to. You don't want to go about having to make cold calls to get a student help, because it will be frustrating and it will not be particularly productive. Having local agencies, community agencies, hospitals, treatment centers come and do presentations to your team can be very helpful in building a bridge. Having a person you can pick up the phone and call and say, I've got a kid, he just told me that he's using 6 bags of heroin a day, really needs help, has been struggling tremendously, can you get him in? Versus calling that, if you have a relationship with someone at a place that can address that need, your chance of having that agency respond are much better than if you're making a cold call to their general number. Integration with other school-based programs. So having connections with the programs that are being conducted by the social work department, by your counselors, cross-referring. If a counselor has a particular interest, is not necessarily part of your team, but has a program going on that might be of benefit to, it could be a peer mentoring program or something of that nature that would be beneficial for a student. It's in your best interest to have some seamless integration between what your team is trying to identify and resources within the school. And then program evaluation. Sound familiar? It's is what you're doing effective? Is the student assistance program doing what it is setting out to do? And you can only do that if you are doing progress monitoring, if you are collecting data, if you're doing program evaluation. That's the only way to tell whether or not you're having the impact that you're putting out, that you're setting out to do. Is the student's attendance better? Are their grades better? Is that happening across students, across multiple students or student groups that you're intervening with? So having good program evaluation at the back end, whether that's at the end of the year or on an ongoing basis, is crucial to inform whether or not you're being effective and highlighting what areas of need your team or program might have. So we talked about some of these already. But where SAP and RTI kind of fit together, Tier 1 SAP-led prevention strategies fit Tier 1 interventions as whole school exposure. So things like Red Ribbon Week or a social norms campaign, social norms marketing. Those are whole school exposures to prevention prevention and it's a good Tier 1 intervention.
I also want to
Tier
mention
2
there,
is. Mm-hmm.
I also want to mention there in Tier 1, it also includes things like Too Good for Drugs or a Project Alert kind of thing that's done just for a specific grade level. In terms of prevention, evidence-based prevention programs that are identified as model programs through the National Registry of Effective Programs and Practices, NREP.gov, has that list of those model prevention programs that are all evidence-based.
Is that maintained by SAMHSA?
Yes, it is.
Yes. So that's something you can get to through the SAMHSA website, as well as materials for whole school prevention strategies. SAMHSA has a lot of good resources and free resources too. So it's worth checking out, as well as that listing of the registry of evidence-based programs. Mm-hmm. Tier 2, students typically are we're doing Tier 2 frequently. We're getting referrals of students that are deficient in some way in the social emotional realm, and then and then identifying gathering data in order to develop a strategy to how to better focus on that student and help them succeed in the social and emotional realm. So if a teacher is noticing that in first, second, third period, a student's falling asleep consistently in class, they can make a referral to the team, and that team can gather data on whether or not this is a whole day thing. And the reason you have different disciplines is that the school nurse might have some insight from their chart saying, well, they started on a new medication and it's making them sleepy. Well, the problem's been identified, so then you can intervene with that student and the family and come up with a strategy for how to address that and how it's impacting them academically. And then Tier 3 SAP interventions clearly indicated when a student's behavior or academic performance is significantly impacted or declines rapidly, that you really need to get that student in individually and that family in individually to address the issues that are impacting their ability to succeed. So why do we need SAP if if an RTI team can serve the same function as an SAP team? And this is a question you might get from an administrator, from a school board, or from a district. Why do you need SAP if you've got RTI? They're doing the same thing, and RTI is a federal mandate, so we've got to do it anyways. Why have SAP? Well, RTI is at its core a deficit identification model. Students are identified as needing more increased intensity in intervention because there is some deficit in their performance in the areas of math or reading or behavior. So a kid that's acting out, not coming to school, boom, that's a red flag. That kid needs some increased intensity of services. Someone's failing repeatedly on their math tests or not making adequate progress in reading. Boom, that's all right. That kid needs some help. There are a significant number of students with social and emotional needs that will not trigger on an RTI deficit identification model. That these are kids that are doing just fine in reading and just fine in math and are not a problem in the school setting. They're still suffering significantly or have social emotional deficits that could use intervention and assistance. A classic example is a student who suffers from an eating disorder. Eating disorders have the highest mortality rate of any mental health issue in the Diagnostic and Statistical Manual. More percentage-wise, more people die from eating disorders than anything else: depression, alcohol, drugs, et cetera, et cetera. But these kids in your school that suffer from eating disorder also tend to be very good students. Academically, they achieve very highly. And they are not problems. These are kids that are involved with 2, 3, 4 activities, sports, et cetera, et cetera. These are the kids that you point to and say, hey, look how well we're doing. We have this student that does all this stuff. In the meantime, they're wasting away. They're starving themselves. They're binging. They're purging, and clearly need help if they're to avoid some serious consequences from these behaviors, from this problem. RTI will not identify those kids. Kid might be doing well academically, not be a problem at school, not draw the attention of the dean's office. Could be homeless. Could be undomiciled. Clearly, that student needs assistance and can benefit from some help from a problem-solving team. But RTI would not identify them as having a need. So that's all very interesting. But what do I do now? That's always the big question. As Dale had mentioned earlier, RTI is a mandate. It's supposed to be, your RTI plan is supposed to be incorporated into your school improvement, therefore your district improvement plan. And that was supposed to be done a few years ago. There are still some schools that are struggling with implementation of said plan, but most schools have complied and included that RTI plan. If you don't have, if someone from your student assistance team does not yet have one, because SIPs and DIPs are updated every couple of years, it's a good idea to have or recruit someone to be on that RTI team at your school building level. Get a seat at the table, because here's what that does for you. Is if you're able to include SAP, student assistance, specifically your student assistance program interventions into the RTI plan, if you're able to integrate them into your RTI plan, they then become part of your SIP and your DIP, which ensures at some level some sustainability, because once it's in the plan, it's got to happen. So having a seat at the table so you can bring to your school administrators in your district a ready-made plan on how you're going to help address not only the behavioral but the academic aspects of RTI, because a student who has redress of their social and emotional issues are better able to focus and perform academically, and your program evaluation will help bear that out. It's in their best interest to include it and provide some support for that team. So with that, I've included here my email address and my phone number. If you have questions, if you have comments or concerns, or are looking for some advice on how to implement such a strategy, and how to what questions to ask, who to pin down, so to speak, who to get on your side, I'd be happy to answer any questions you might have via email or by phone.
And Don, I wanted to add to kind of your last point about kind of the what do I do now, and I think it's important that student assistance teams look at how do they integrate with their RTI if the system is working in their schools. How do they integrate not only in terms of programmatic integration, but also just the paperwork piece. You don't want to have 3 or 4 different referral forms and a staff person trying to decide which referral form do I fill out for this student. You want to have one kind of concise referral form that goes to one place, and the RTI, SAP, if they have PBIS, people all kind of get together and triage that and decide which system makes the most sense for that student at the current time based on the issues that we're seeing with that student. Also, I think it's important to remember that SAP, while it fits within the RTI structure in terms of the tiers, it also is unique in terms of if a student has a need, they don't have to kind of fail to meet expectations at a certain tier to be bumped up to another tier. If they have a need, they go into an educational support group in a Tier 2 level. If they have a need, they go directly into some case management and action planning at a Tier 3. So I think that's important information as well.
Exactly. So we're it's something to be cautious about is that there are these things that can be territorial. It's in an SAP team's best interest to be collaborative. There was a series of PBIS trainers that were advocating for people who were being trained to get rid of their SAP teams, that their PBIS teams would fill that role. It's best to be collaborative with them because, again, PBIS is a strict RTI model and is deficit identification. It doesn't address those kids that fall through the cracks of a deficit identification model. So reach out, collaborate with other teams in your building. That will also help build sustainability for your program.
And I'm going to open it up and ask if anybody who's on the call has any questions. So I'm going to unmute you. If you have any questions, feel free to ask those of Don now. Hearing no questions, I want to thank everybody for attending our webinar today. If you have additional questions, obviously you can contact Don at his information that you see there on the screen, or you can contact me at the Student Assistance Center. My email address is dale.gasparovic@prevention.org. And my phone number is 217-299-8803. Thank you again for attending, and we look forward to seeing you at our next webinar in a couple of weeks. Thank you, Don.
Thanks, Dale.
All right, have a good day, everybody.